It is 19 past 9. David Iliffe with you. Well, we were just talking to Megan O'Hara-Sullivan, who's taking on the epic Everest Base Challenge. We spoke to Chris Black, who's the chairman of the board for Momentum Mental Health. I think it was around about September last year when the idea for this trek first got into his head, and we were talking about it. I was pretty impressed then, but I thought, because we've spoken to Megan, it'd be a good chance to focus a little bit on Momentum Mental Health if you're not exactly sure what the group is all about. So with that in mind, joining me in the studio, Wendy Green from Momentum Mental Health. Wendy, good morning.
Good morning, David. Thank you for having me.
Now, the first question is, how come you're not going? Were you tempted to sort of sign on?
Well, I've sort of put my husband forward. He's opting in for me. So Alistair Green, my hubby, he's one of the crew that's going among the current 19. So I feel like my family is definitely doing their part.
So you will be walking vicariously through your hubby.
And apparently there's unbelievable mobile reception on the mountain. So we literally are going to be able to do so many great check-ins.
Is that right? Really?
Yeah, I guess it's high. So, yeah. I mean... You can see the towers. So, yeah, that was the feedback from our amazing expedition leader, Ben Southall, that you have such great mobile reception on the mountain. Our little ones, we've got a 9-year-old and a 7-year-old, they're really going to get a beautiful opportunity to chat with Dad via video every night.
I was going to say, it won't just be audio, it'll be by video as well if the reception's that good.
Yeah, and for
That's
them,
brilliant.
How cool is that? Their dad's climbing to the bottom of the top of the world, and that's what he's doing. And,
absolutely.
And, you know, with 18 other beautiful people who care about mental health but also care about stretching themselves.
Yeah. I mean, it sounds like it's going to be a fantastic event, and more power to Megan and Chris and Ben and a whole host of others from this part of the world who are doing it. But that'll be hard. The fundraising goal of $100,000 will go a long way to helping Momentum Mental Health.
Tongue twister,
I've been talking too long this morning. Continue the vital work that the organisation does in the region. Tell me what that money will pay for. Is it specific, or does it just go into coffers because you need money to run?
Okay, so we are so fortunate that at Momentum we are funded by the Primary Health Network to work with people who have mild to moderate and severe and persistent mental illness. However, we have a passion project that centres around working with people who aren't sick yet. So it's called prevention, and the government just doesn't have money for that. They are throwing all their money at the pointy end when people are very unwell.
Yep.
So
which is necessary,
absolutely.
But it's not so much a preventative thing.
That's
though, is
right.
It? Yes.
So fundraising allows us to work with people in the prevention space. So we start working with people early on before they're feeling unwell on wellbeing. And it's proven that if somebody fills their wellbeing cup, when that inevitable trauma comes along, because we're humans and trauma's going to happen. Mm-hmm. We're going to have loss. We're going to have incidences in our world that will rock us. If your wellbeing cup is full, you will cope better. Of course, there's going to be people who will always need that higher level of care. They're going to need medication to live their best life. But many of us can prevent tipping over the edge if we just prioritise wellbeing today.
Yep.
And so at Momentum, that $100,000 allows us to work with those people.
And Megan touched on it before, and this is the part that I think is extraordinary, and you just mentioned it there, is that through what you're doing, you're actually taking down this major barrier, which is if people feel like they would like to talk to someone, you know, they feel like they've got issues that are maybe developing, they don't need to go to their GP or have a referral to come and see you guys. So
and isn't
really,
that phenomenal?
It's a major barrier just completely removed, which is fantastic.
Yeah, no diagnosis, no referral needed, and David, no cost to access the service because of this vital fundraising that we do. So, look, I fight really hard every day against the stigma around mental health, but we've got a long way to go. So walking across the threshold of a mental health service, that can be a really tricky, challenging thing for a human. So we talk a lot about wellbeing, and we make it as easy as possible for someone to walk through the door and just check out what we're doing, see if there's something that'll help them fill their wellbeing cup. And hey, if in their one-on-one sessions they need that higher higher level, no one has to know. It's their business.
Yep.
And we really work where we can out in the community. So the way we intentionally work with people is that you don't have to come and talk about your trauma for the next 20 years every week. We talk about, if you'd like to, the things that happened, but where do you want to be? Okay, what's a goal related to where you want to be? Right. What's the next action to get towards that goal? And then, if we're doing our jobs the way we want to do them, we go out into the community and work with the person around that goal. And what someone's goal is completely up to them. It's so individual. It could be, I want to feel comfortable going into the shops because I get a lot of anxiety. It could be, I want a job.
Yep.
It could be, I want to feel comfortable having dinner with my family this Christmas because I always feel like I let them down. And we'll work with the people exactly where they're at to create that next action. And hey, we don't even need to wear our uniform when we're out in the community. If someone just wants us to walk alongside them and just wants that help, that hand up, we're never going to do it for somebody because everyone's got it within themselves to help themselves when they've got a little bit of support.
That's fantastic. It strikes me that this idea, though, of offering the service to people who haven't presented to their doctor and then been referred on to you as having an actual official diagnosis of some sort of mental condition. Is that a new way of thinking in terms of the service that you can offer? Say the person you're going to employ with this money that will help people at that end of the spectrum, if you like.
Yeah.
Is that a completely different approach that they have to take to the approach that they would take to someone who walks in with a diagnosed mental condition?
Yeah, we are certainly working hard to flip the way that we look at mental health. And look, where possible, we gracefully educate our friends that are in the clinical space as well around, hey, let's make your workload less and work with people before they're really needing you. I think that, now and again people rail against it a little bit. Like you definitely can use Momentum as a wonderful addition to the service menu that you have happening in your life. So someone may only be able to get in to see a psychologist once a month. They may only be able to afford once every 2 months, whatever it is. At Momentum, they can come and we can be the buddy where they continue to just work on themselves, do something for themselves. The 5 Ways to Wellbeing is a huge part of the way that we work. And essentially it talks about that there's 5 small things that you can do in your daily life, and they just have to be small things. If you give people huge things, they're going to fail and feel like crap about it.
Yep.
So it's connecting with others, being aware, getting active, of course, that was always going to be one, helping others, and what's the last one? I always forget it.
Is it something along the lines of gratitude?
Keep learning.
Oh, okay.
Yeah,
yes.
keep learning.
Yes, absolutely.
And so if people do small steps around those, intentionally, they become habitual. And that beautiful feeling of connecting with someone that fights isolation and loneliness, #1 killer in Australia. Helping others, wow, like it's just such a beautiful thing to selflessly help another human. Being aware, we spend so much time in our minds feeling anxious about the past or the future. Let's focus on the present right now, and you remove a little bit of that anxiety potentially. It's just good stuff, David. If we learn about it, we can probably do it.
Yeah, absolutely. It's just being aware of it for starters. That's really the starting point.
Yeah,
isn't
that's right.
Just really quickly, that's a bold new sort of addition to what Momentum Health is offering. But just to backtrack a little bit, and I know we talked about it quite a bit at the time, but Momentum Mental Health used to be the Toowoomba Clubhouse.
Yeah.
Besides what we've just talked about, has what Momentum offers now changed from the Clubhouse days? Is it fundamentally a new model? Because I guess that coincided with the NDIS and other things as well. So what are the key differences between what the Clubhouse was and what Momentum Health now is?
Yeah, we are a completely different service. Yeah, for 25 years, the Toowoomba Clubhouse was a pivotal part of this community and they did such amazing work. However, enough wonderful services have popped up in our town that will focus on maintaining good quality of life for people rather than stretching them towards goals. So that's our new focus essentially, but also that beautiful privilege to now work in the prevention space, because the clubhouse model really does rely on people being part of diagnosed funding programs.
Yes.
And so we just wanted to stretch our wings and be able to welcome more people essentially, and then tackle that whole of community wellbeing pie in the sky, which we're, my moonshot goal, I reach for it. That's my thing. I'm like, yes, okay, will this program do this? Is this getting us a step towards prevention? Yes, let's do it.
There you go. I'd never heard that term, moonshot goal, before.
I stole that one from my husband. It's definitely Alistair Green's. Sorry, full credit to him.
We have to credit him. Okay. Yes. This announcement was written by Alistair Green. Former mental health. Fair enough. Final question. There's a big epic trip and that $100,000 hopefully will be raised, which is fantastic. We've talked about what it's going to be spent on. Presumably the bar has been set now that you're going to have to come up with some sort of a challenge every year. How do you top this, or is this Chris Black's his wheelhouse? He can worry about that.
Our amazing chairman of the board, Chris, has an adventurous heart and a wonderful spirit. And I did say to him, I think from a workload PR point of view, we could probably do this biannually if he's got other amazing things he wants to do. And look, it's a big, vast world with wonderful things that people want to experience. And I think the idea with this was stretching yourself, challenging yourself, ticking something off a bucket list. And hey, let's face it, David, at the deep, dark crux of it, the charity dollar is a hard dollar to grab these days. We've got amazing services in this town, and you've got a lot of people shouting at you for your charity dollar. So if we can do something a little bit interesting and cool that gets us into people's minds that Momentum does cool and interesting stuff. It makes our job that little bit easier when people want to walk through the door.
Yeah, most definitely. I think the trick these days, and this trip has done it, is to obviously give people a chance to raise funds, but to do it while they're doing something that is a bucket list thing, or that is something that they wouldn't have been able to do otherwise.
Absolutely.
Is just the key. So,
and with a great group of mostly born and bred Toowoomba people, I think they're going to have a wow of a time. They're going to have sore feet every night, but they really are going to have a really great time together, because they are they're all varied from different walks of life, but they have to have something in common because they have all decided they wanted to do this amazing thing.
Yep, absolutely. I reckon it's going to be great. I would love to be on it, but
David, next one.
Exactly.
Put in your votes for Kokoda or whatever it's going to be. I've got no idea.
Well, Megan, every time I see Megan, she keeps saying, "Oh, there's still one spot left." And I said, no, well, someone's got to stay back here and present a radio program.
That's right. Maybe we'll connect you to them on the mountain, hey? The reception's very good, I hear.
Yes, that's right. Yeah. FaceTime, voice calls, whatever. Wendy, a pleasure to have a chat to you. Thank you so much for coming in.
Thank you.